This is Daily Blast Live. We're talking about what you're talking about. Real, honest, entertaining, live. DBL starts right now.
3, 2.
Welcome to DBL. It is Tuesday, January 26th. I'm Sam in for Tori. I'm here with Brandon and Al. Lindsay joining us from home. The struggle to get vaccinated is very real for many older Americans. We've been reading your stories, DBL Nation, but now there are reports that Hollywood elites are going to great lengths to game the system. Some are reportedly offering bribes of $10,000 to skip the lines. Others are trying to pose as healthcare workers or as staff at nursing homes. Some are even traveling great distances, going to areas where the shots are easier to get. Speaking of which, this wealthy Canadian couple has been accused of booking a private flight to a remote area of Canada, then posing as motel workers in order to get vaccines meant for Indigenous residents. They've been charged and they face up to 6 months in jail. I read this last night. I saw red. bed, my stomach was sick. I immediately thought of, because I've been reading all of our viewer comments saying that, one viewer saying, my 95-year-old mother, I cannot get her a vaccine. Or someone else saying, my autoimmune compromised 20-something-year-old college student can't get a vaccine. So when we have Hollywood or very wealthy people, Al, skipping the line, this is life or death. What should the consequences be, considering if 95-year-old grandmother out there doesn't get her vaccine because Mr. Hollywood does, and then she gets sick? What are the consequences?
Well, I mean, we need to break it down. When we're saying Mr. Hollywood or Mr., we're talking about the wealthy, the privileged.
Right.
And you have to remember that these stories we cover from day to day, Sam, Brandon, Lindsay, they mean something in the public in the public mindset. When you start talking about things like the Varsity Blues scandal,
yep.
What was the repercussions for that, Brandon? 9 days?
11.
8 days? That was the precedent we set as a culture, as a people. That is what the punishment you get for using your influence. So now we can't fall out of our chairs like we cannot believe that these wealthy people are taking advantage of that system. They go to Club Fed, those beautiful prisons. We interviewed a guy from Attica yesterday. So like when we start talking about outrage now, there was no outrage then. And because there was no outrage, the prison sentence reflected that, Brandon.
Hey, and you know what? I don't want to be a hypocrite here, because yesterday, I tried to call out the elite. I tried to call out the wealthy on the sense that they don't care. But I'm not going to be a hypocrite. In DBL Nation, you shouldn't either. You know goodness well, if you were Mr. Hollywood or Mrs. Hollywood, or you had the money to get this vaccine, you would take it.
No, you wouldn't.
You would.
No, you wouldn't.
Sam, we would all take it. Sam, you know me. I wouldn't do what that couple did. That's evil. They're going to have to answer to God for that. That's evil. But if I had the opportunity, especially with Dr. Fauci saying on Good Morning America and all these shows that there are so many unused doses that are going to waste, I would use my money and donate or try and give $500K to get that vaccine, but that money has to go somewhere. That charity, that money has to go somewhere, because other than that, that unused doses, that's not going to grandma neither, though, Sam.
I know listen, of course that's honest. That's what the show's about. And Lindsay, please jump in here, but I know you, Brandon. I know that you're also a person that thinks that you have a conscience and you think about karma. I know for me, of course, there's the temptation because you want to protect your family. And at the end of the day, we're all survivalists. But I would not be able to go to bed at night knowing that healthcare workers, my sister is a healthcare worker, her husband is a healthcare worker, still waiting on their vaccines, have yet to get their vaccines. At least, Lindsay, the ultra wealthy have the privilege of staying in place, of ordering in food. They have that luxury.
I think it's just really about morals, like what we saw throughout the entire pandemic, like the people who didn't care and used their privilege and just were willy-nilly versus the people who were in underserved communities that really had no choice and were kind of exposed to the virus and really dying at rapid rates. And so at this point, like you said, you have all the privilege to be able to stay in the house and protect yourself. And unless you have a pre-existing condition that's making you be wealthy and also have to get in dire need of the vaccine, then really you should just wait and just have like a moral compass in this. But I also think it's contradictory that as a country, we sit back and watch the NBA and watch the NFL, and this is no offense to Brandon or anybody that loves sports, but we watch them and they all were able to get tested at a quicker rate than anybody else in the country. And we just said, praise that, because we wanted to watch our football, we wanted to watch our basketball. And so what do you think is going to happen with the vaccine? The same thing. And so we allow it and give it to a pass to certain groups and organizations that entertain us, but then on the other hand, we're shaming an entire group of people who take it upon themselves to do the same exact thing. So it's just confusing to me.
Well, something needs to be done.
So thank you for proving my point.
Something needs to be done, and something is being done in Canada. That couple faces 6 months. So I hope that there's a precedent here in America. And
they'll be able to get a great lawyer, and they'll be exonerated, or they'll do 9 days.
I think this is different. I disagree with all of you here. I think this is different, and I think when it comes to life and death, and someone in law enforcement, when they lose their 95-year-old mother because someone else with wealth took that vaccine, so to speak, from them, I definitely think that there'll be some sort of consequences.
I'm not talking about taking it away from someone's grandmother. I'm talking about this came out of Anthony Fauci's. This is coming from Anthony Fauci's mouth. There are unused doses. If that rich person is not getting it, then the 98-year-old grandmother isn't getting that either.
Put the unused doses aside. there's still a line, and no one should be cutting the line from the people that are at most risk or are healthcare workers that have to go to work every day, frontline workers, as opposed to the ultra wealthy who literally have the privilege of sitting at home on their couches ordering in food. I have comments here. I'm glad we're having this conversation, though, and I appreciate the debate. Mike says, I'm sure money talks, and they got plenty of it. Too bad they all can't come together to help the very same people that made them rich and help people now. Lori says, not much you can do. It's not just celebs, happening all over. All right, well, good conversation. Please continue to write in. We want to hear from you, especially those personal stories. Moving on to former Trump official Kellyanne Conway and her 16-year-old daughter. Their troubles seem to be getting worse. So Kellyanne is accused of posting a topless photo of her teenage daughter on Twitter yesterday. The photo was reportedly posted by Kellyanne's account to a new Twitter Fleets feature, which deletes posts after 24 hours. Claudia posted a video reacting to the news on TikTok. Take a look.
I'm assuming that when my mom took my phone, anytime she's taken it, because she takes it all the time, she took a picture of that. So that was on her phone. And I guess she accidentally posted it or somebody hacked her, but nobody would ever have any photo like that, ever. So Kellyanne, you're going to jail.
Wow, Lindsay, I know we have to be delicate here. Claudia is a minor. If these allegations are true, I can only imagine not only is this revenge porn, but pedophilia because she's a minor. Now, we don't know all the details. We don't know if there was a hack involved. We don't know. Some people are conspiring, saying maybe Claudia is involved. Others are saying Kellyanne did this. We do not know. If this is true, what do you think will happen? And also, if she was hacked, what are some of the fears that you have in regard to that and minors?
I just think the bigger issue to me is the back and forth that they've been having, that the police have come to their house, that the daughter is obviously crying for help on social media, that Kellyanne took so long to step down from her post when her daughter was obviously in need of some communication that was not on social media. And so the fact that they're at this point where she's saying that her mom even had pictures in her phones allegedly to bribe her, it's just a really sad story to watch this play out publicly for that family. And I really hope that they both sit down and communicate and talk to a therapist or somebody that can really come in and try to assist in this situation, because it's so blown out of proportion. And this is like a real family that's publicly, not only getting shamed and humiliated, but also it just has to hurt that her mom is somebody that she constantly feels like she needs to cry out to the public to get attention from.
You know, I'm glad you said that, Lindsay, because you know what? The first thing I thought when that movie Traffic with Michael Douglas, well, Michael Douglas is the Supreme Court judge, and he's been tapped in to fight the war on drugs. But his own daughter was using heroin, and she was doing all those egregious things behind his back. We look at these politicians, and they're always on TV saying, oh, you should have these values, pump these values. And then you open up the lid to their own house, and you see that they're they're just like us. So I don't understand why we're always pitting each other up against each other in this party this and red this and blue this when we're all the exact same, Al.
Social media, Brandon, has let everybody into everybody's life. And we have to look at a story like this. We see a family in crisis. You got Daily Blast Live is going to make me defend Kellyanne Conway here. I love this show, but I hate this show for that. I believe that Kellyanne Conway will lie for a check. I believe she will stare right in your face and say something she does not believe to be true. But there are levels to this, Brandon, Lindsay, Sam. And posting a nude photo of your daughter is a level way beyond. Yeah. So we have to give her the benefit of the doubt that she is still a human and that she was hacked. Yeah. They are public. It's easy. I'm sure her phone isn't difficult to crack. I'm going to be able to sleep tonight hoping that she was hacked, Sam.
I really do hope that she was hacked. But at the end of the day, regardless of what happened, my heart aches for Claudia, considering that she is a minor and she has topless photos out there.
And that is family.
The most, unbelievable.
Sad.
We'll have to follow that story. Lindsay, stick around. Coming up on DBL, we are tackling the latest COVID-19 headlines with our medical expert, Dr. Payal Kohli. Could one of the vaccines be harmful to pregnant women? And does swearing do the body good? The reasons why cursing can actually be beneficial to your health. Next.
This is a
Welcome back to DBL. For the longest time, swearing was seen as low class and vulgar, but it might actually be good for you. Studies show cussing may be a sign of intelligence, especially knowing when it's appropriate to swear or not. Studies have also linked profanity with honesty. Swearing also improves your tolerance for pain. Remember that next time you stub your toe, okay? And cussing is also associated with creativity. Finally, profanity could also have an evolutionary benefit. People who hurl bad words instead of punches are more likely to survive. Ooh.
What do you think the origin of punches is? Cursing.
Huh?
What?
When people curse at you, that's when punches start flying. A lot of people don't like that, B.
No, but a lot of people have a lot of bark, no bite, so they curse so they don't have to punch.
Until they do.
No, I'm not with you on this one, Al. I disagree with you.
What?
Lindsay, are you...
Okay.
Lindsay, are you one to, for me, when I use certain profanities, it just makes me feel that much more empowered, that much more excited. What about you, girl?
Listen, I'm from New York, so we curse about anything. People cutting us off the road. Like, I had to try very hard as I pursued this career in media to tone it down, tone the New York down, and really just, you know, be professional. And so, yeah, I curse all the time, but I have to really watch my mouth. And I consider what I say.
Lindsay, here's my point. You and Colin are out to dinner in a post-COVID world, and some guy calls you out your name at the bar. How's that going to work out for him?
Oh, well, Colin would do the second thing, the punch it.
Yes, that's my point.
Okay. All right.
I'm just saying it heightens situations that might not need, because certain people, I do not react well to that. Joking around all day, I could care less. But directed at somebody I love, whether it be Brandon or Sam or Lindsay, it's going to be a problem. And that's why I try and watch what I say, because you don't know what word could set someone off.
I agree with what Brandon said about people doing that being really small. Like if you're cursing telling a story or something, I understand. But if you're at a restaurant, and you start getting loud, calling somebody out their name, I really think that it shows, it's almost laughable to me. I think Colin and I would honestly laugh in their face.
Totally agree with all of you, but we're only focusing on that one negative part of the study.
It was the fun part of the study.
No, the other parts are saying if you curse that you are intelligent, if you curse, you're very creative. Of course, if you're doing it
But wouldn't that mean that you had a lack of words and adjectives to describe what you want to say, so you have to use use a filler word. Yeah.
You can use it as a preface.
Yes, but you could also use the other 25,000 words that instead of the first word.
Albert Jackson, I can't even begin with you considering how many times have I hung out with you casually and every other word sometimes.
Is
Albert
what?
Jackson. Albert.
Yeah.
Even in the group chat.
Yes, they'll be flying around there with family, but not out in public.
That's what we're talking about. I'm not saying that you need to go to a bar and hurl an insult at somebody because they don't like the Cleveland Browns.
Ooh.
See, now that almost got a beat right there.
Offense right there.
Wow. Coming up on DBL, Dr. Payal Kohli returns to discuss the latest news in the coronavirus pandemic. Don't miss her vital information coming up next.
Nearly 100.
Welcome back to DBL. The Biden administration's plan to administer 100 million COVID-19 vaccines in its first 100 days just got kicked up a notch. Yesterday, President Biden announced he believes the country can administer 1.5 million shots a day in the coming weeks for a total of 150 million vaccinations in the next 100 days. So we've got our Dr. Payal Kohli joining us live.
Yay.
Hey, doctor. Okay, so what do you think of this updated plan? Is it doable? Do you wish it would be more vaccines, less vaccines? What would Dr. Kohli do?
You know, if you had asked me a week ago, I would say that even, 100 million is ambitious. But where we are today, I'm actually feeling this is very doable. And the higher we keep pushing that ceiling, the more we're going to get those vaccines into those arms. So if you look at the trend of what we've been doing since December 14th when we started vaccinating, it's really shown a nice increase in the number of vaccines we're giving each week. In fact, just last week, we gave an average of 1.25 million doses every day. So I think we're getting ever closer. And the reason is because we figured out what we need to make this a reality. We need just two simple things. We need the vaccines and we need the vaccinators. So the vaccines haven't really been a problem because the supply chain has not been disrupted. And many companies have now committed to delivering several 100 billion doses in the next couple of months. So I don't see that being a problem. It's really the vaccinators, the facilities, the people, the logistics that has proven to be a problem. But we've now seen more mass vaccination sites being rolled out. So I think this will all become a reality very soon.
All right, some good news. I'm sorry, you have to give me a second, Doc. It's like it's been some months, so I'm like, wait,
I know I'm usually the bearer of bad news. I'm usually the bearer of bad news, so I mixed it up a little today.
I love it. Let's go with that. Now, the World Health Organization says the Moderna vaccine should not be given to pregnant women. What do you think about this?
It's interesting. So this warning is based on the fact that we have a lack of data. What we do know, Al, is that pregnant women have a higher risk of having a serious COVID illness. We also have some data actually that snuck in because some of the people in the Pfizer trial were pregnant and didn't know it, but ended up getting the vaccine. And then they went on to have normal pregnancies and deliver normal, healthy babies. So I actually feel different from the World Health Organization. I think if you're a pregnant woman with a high risk of exposure, if you're a pregnant woman with a lot of serious underlying medical problems, or if you're pregnant with average risk but late in your pregnancy, you really should talk to your obstetrician about getting it, because with the virus raging in the community, the vaccine is one of the ways in which we can protect these women.
Wow.
That's two good newses in a row.
We're 2 for 2 right now, Dr. Coley.
Two for two.
I'm up.
Are you
I'm
ready
on the
for
wheel.
number 3?
I'm on the wheel right here. So I hear that there's a drug that's normally used to treat gout that could help patients with mild cases stay out of the hospital. Could you elaborate on that?
Dr. Coley, we just talked about this, you and I, last night. To our viewers. Yeah, Dr. Coley's been helping my family out. And Dr. Coley, please speak to it.
Yeah, this is really, really, really good news, guys. So this is a drug called colchicine, which has been around for decades, so we know it's safe. It's usually used in gout. It's an anti-inflammatory. And what we're learning is if you give it to people who test positive by PCR for COVID early in the course of their illness, you can reduce their chance of getting into the hospital by 25%, reduce their chance of getting on a ventilator by 50%, and reduce their risk of dying by 44%. So this is a drug that's available, that's well tolerated, that we can give to outpatients and really change the trajectory of things. So I was so excited to hear this because it's the first oral drug that's available to outpatients as prevention. And I'm really hoping that Al will give me a silver lining shout out for this one because it's just such good news.
Y'all. We needed this today. This is just all good. This isn't even a silver lining. So let's get out of the segment now.
We love you, Dr. Coley.
Thanks,
Thank you.
Thanks, Doc.
We'll be right back.
Promotional consideration.
Welcome back to DBL. You see them all the time. Sweepstakes or contests for a free brand new car. But if you win, should you keep it or should you just take the cash instead? So we're going to chat about it in today's DBL Drive, sponsored by CarShield. So if you're lucky enough to win a new car, be prepared to give Uncle Sam his cut. Winners often pay 1/3 the amount, yes, 1/3 of the new ride in taxes. This burden can be a nightmare, but if you don't want to deal with the hassle, you can actually opt for getting the cash value of the car instead. You still have to pay the same taxes, but at least you'll have the money up front. When it comes to your car, for peace of mind, get an auto protection card with CarShield. CarShield protects their members from the high cost of auto repairs. Call 1-800-505-9619 for a free quote.
My mother told me growing up, nothing in life is free, y'all.
No.
Nothing in life
What
is
about
free.
love? Oh.
Sweet.
And it's not. It's super expensive. It is.
Wow, and you almost had it, Al.
Yeah.
Almost.
Sam going on $5 dates.
DBL's new every day. We'll see you same time, same place.